Hello. We're going to go through this first article, and as we go through, we're going to pause at various points to note some things about structure, about how this author, where this author puts their claim, and how they support it. So, um, this is called U.S. Citizens Are Dying and We Can Save Them. This is one of the winners from the op-ed contest. United States citizens are dying and we can save them. I have a luxury that 27.3 million Americans don't: health insurance. Without it, my family would be hundreds of thousands of dollars in debt, or I'd be dead. So, really startling statistic, and sort of a question leaving us wondering why they'd be dead. In the beginning, certainly haven't gotten to our claim yet. In June of 2017, when my blood became dangerously acidic and my kidneys started to fail, I went to the ER. In June of 2017, when Alex Rishon Smith's blood also became dangerously acidic, he died before anyone could save him. Alec didn't have to die, though. The insulin prescribed for his type 1 diabetes could have saved him from the diabetic ketoacidosis that killed him. Alec, who had recently turned 26, could no longer afford his insulin because he was kicked off his mother's health insurance plan. Unable to afford the $1,300 a month cost for his insulin, he turned to rationing the insulin and died within 1 month of becoming uninsured. In the weeks after both of our incidents with acidosis, I went back to hanging out with friends and enjoying my summer. Meanwhile, Alex's family was left making funeral arrangements. So we can see here there's a really effective use of two different strategies. One of them is the juxtaposition. She's comparing two different cases and how they turned out differently. She's telling a personal anecdote, right, by talking about herself. But then she's also telling the story, giving evidence about this kid named Alex, but she's doing that in a story way. She's not just giving evidence, she's like telling his story with the evidence embedded, as if it was a narrative. There is only one way to prevent innocent people like Alex from dying: adopt a national health insurance. So here we finally have reached our claim. We're in the third paragraph. With a single payer program where government subsidizes the cost of treatment, any and all citizens would be able to receive and afford medically necessary treatment. Many fear that this program would cost an exorbitant amount of money, and it is true that U.S. citizens would have to pay more in taxes to support it. However, U.S. families would save more money because they are no longer paying as much for healthcare costs like copays, premiums, and deductibles. According to some studies, Senator Bernie Sanders' healthcare plan, which includes restrictions on drug markups, could save the U.S. $2.1 trillion in the long term. We saw several pieces of evidence and reasoning here, right? And you're going to identify where you see evidence, where you see reasoning. I have health insurance that covers hundreds of thousands of dollars in medical bills, but that coverage runs out in 9 years. My life after 26 is uncertain. Will I have a job that provides health benefits, or will I be left wondering or hoping that I won't get sick again? Health insurance can no longer be a political bargaining chip that gets thrown around as if people are not dying without it. To make nationalized health insurance a reality, people like you need to decide that healthcare is no longer a partisan issue, it's an American issue. If we adopt nationalized healthcare system, I will no longer live in fear for the day that I might not be okay. I'll know that my name will never be splashed across newspapers reminding politicians that they've killed one more citizen with their complacency. Okay.